All right, calling all parents that send their children off to school. Maybe you got some milestones in your life. For myself, right? We just sent our boy Wolfie to daycare for the first time. But I know for some of you, you're talking about sending your child off to elementary school or high school or CJEP or university. Now, there's a recent study bringing fresh insight into what can affect young adults' mental health during their first year of university. I'd love to hear from you, by the way. Send me a text message if you've recently had a child go off to university. How'd you feel about that? Now, researchers at McGill University and UCLA found that students who describe their parents as overprotective are more vulnerable to anxiety when they transition to university. Let's go to Dr. Anna Weinberg, Associate Professor of Clinical Psychology over at McGill University. Dr. Weinberg, welcome to the program.
Thank you for having me.
Now, I got to say, off the bat here, I just read that intro here. I'm not surprised. In my mind, it's like, yep, makes sense to me. But
Yep.
what did you find here in this study?
Yeah, it's a good. So this is a good example of something that we sometimes call booby research, right? Like, is it something that you're going to tell your grandmother, and she's going to be like, well, obviously, right? My booby knew this from way back, but nonetheless, having kind of this documented evidence of it can be really helpful in trying to convince parents sometimes. So what we find is exactly what you said, that first-year university students, and we really tried to get them in the first month of their first year of university, who said that their parents were over-controlling, overprotective, meaning that they didn't let them make their own decisions. They really tried to always protect them from any dangers or even any experiences. That those students, when they encountered the stress of the transition to university, were much more likely to experience anxiety.
So we know the what. But
Yeah.
do we have any idea as to the why? Like the link between the overprotectiveness getting to anxiety?
Yeah. So that's a great question. This study doesn't directly speak to that, but our work with parents over the years, and especially parents of anxious kids, gives us some hints to this. So one of the things that we know is that overprotective parents, and just to back up, and we want to say this is really driven by love and concern, right? These are parents who love their kids and are working really hard to make things go well for them. But one of the things that they tend to do is, when their kid encounters challenges or when their kid encounters stress, the parents rush in and try to fix it for them instead of giving the kids opportunities to practice skills in dealing with those things, right? So one of the things that we often talk about is you think about the transition to university as going to the ocean, and it's really wonderful to go to the ocean. The ocean is great. And, there are challenges. It can be a little dangerous. And you don't want the first time your kid encounters water at all to be when they get in the ocean. You want to give them lots and lots of opportunities throughout their life to practice doing the things that will allow them to navigate the ocean effectively. So maybe you start out with, letting them navigate a conflict with a friend on their own, letting them navigate academic challenges on their own, or talk to teachers when they get a grade that they don't want, instead of stepping in and trying to do it for them.
I have to ask you because in my mind, this is not something an overprotective parent wouldn't start being overprotective and when the kid's in CJEP. They'd probably start from a younger age, right?
Absolutely. Yeah, absolutely.
So, let's talk a little bit about that and what your advice is to parents on how to maybe take those deep breaths and let your child, encounter difficult situations on their own.
Yeah. So, I would say, so you said your kid is just starting daycare,
Yeah,
is that right?
20 months old, and he just started daycare about a month ago.
Congratulations. So I'm also a parent, and I know how hard that is, right? I know that experience of feeling like, as they say, your heart is now outside of your body, and you don't want anything bad to happen to them. But again, you have to remember that bad things are a part of life. Challenges are a part of life. Slightly dangerous things are even a part of life. And if you don't let your kid learn how to deal with those things on their own, then they never will. And the consequences are going to be much worse when they encounter a bigger danger. So it's not that, we're trying to say there's one right way to parent for everybody. It's going to look different for different parents and different families. But there are some principles that we try to encourage parents to keep in mind, which is that not everything that makes you afraid is dangerous. And so you can kind of encourage your kids to have some experiences, developmentally appropriate experiences, right? Matched to where your kid is in life, but that allow them to experience like a little bit of danger, just a taste of it, or a little bit of conflict, or a little bit of stress, and then they learn, okay, this happened, and I know how to deal with it now. And sometimes it even means allowing your kid to fail and experiencing the what it means to recover from a failure.
So, can I ask you if we know, so we know it makes them more vulnerable to anxiety.
Yeah.
But do we have any indication, maybe that's the next study, about outcomes? Like, does it lead to worse outcomes in life for these children?
You mean like academically or in terms of like work outcomes? Is that what you mean?
Both.
Both, yeah. And so we don't actually know that. We certainly don't know this from this study. We do know that anxiety, particularly in young adulthood, is, yes, associated with a lot of, so clinical levels of anxiety are associated with worse outcomes vocationally, educationally, and socially. So people with high levels of anxiety often do struggle across lots of different domains. And so, yeah, working early on to try to help people become more resilient to stressors might be beneficial in improving all of those downstream outcomes as well.
When we started off, you were mentioning, this is one of those studies that my bubby could have told me, 50 years ago, right? But is there something that came out of this that actually was, wow, I didn't expect this, or surprising?
Well, it was that. I think for us, one of the things that was really interesting, and the reason that we tackled this, is because a lot has been done on what the effects of parenting in childhood, right? So we know a lot about parenting, what happens to kids with overprotective parents. We know less about what happens to young adults and later adulthood. So we don't really know what the long arm of parenting looks like. How long does it go? So do people, when they leave the house, do they, learn to develop all of these skills on their own, regardless of what their parents did? Here, we're seeing that, at least in this early transition period out of the home, this key transition period away from parents, that parenting is still really influential.
Dr. Weinberg, going to have to leave it there. This was a really fascinating discussion. Hopefully in the future we can catch up on other subjects. I appreciate your time.
Thanks. I'd love that. Yeah, thank you very much.
Dr. Anna Weinberg, a Canada Research Chair in Clinical Neuroscience, and she's from McGill University.